Before you put your prosthesis on for the day, take a moment to inspect your limb for any signs of redness, soreness, or skin issues. Make sure your residual limb is clean and dry before donning your prosthetic device. Before you roll your silicone liner on your limb, be sure it is clean and dry. Reflect the liner inside out, paying close attention to create a flat surface at the end of the liner. Once it is flat, position the liner flat against the end of your residual limb and continue to roll it on slowly. Make sure there are no folds or wrinkles. If so, you may have to roll it on and off a few times until you get it just right. Suction liners with sealing rings typically require some spray in order to help slide into a suction socket. A few spray pumps of rubbing alcohol or hand sanitizer, both on the sealing ring and inside the prosthetic socket, should be enough to help you don the prosthetic device properly. When donning a skin suction prosthesis, a pull sock is typically used. Be sure the pull sock is properly positioned on your limb. Then feed the end of the pull sock through the exit hole in the bottom of the socket. In order to fully don the prosthesis, it is helpful to hook the pull sock on a solid object, like a doorknob, maybe your foot, maybe the corner of a chair, and then pull the sock out as you push your limb in. When doffing a skin suction suspended socket, take a moment to gently pull some of the skin out of the proximal trim lines of the socket first. This will help to make it easier to remove the prosthetic socket. When removing a silicone suction liner suspended prosthesis, undo the suction valve and have a seat. Then push your prosthesis off your residual limb, replace the valve, and roll your silicone liner off. When you take off your prosthesis for the day, take a moment to inspect your limb for any signs of soreness, redness, or skin issues. If you notice something that doesn't look quite right, you should probably set up a time to meet with your prosthetist for an adjustment.